Today, I think we really are going to raise a lot of awareness and educate people about prostate cancer and about screening and PSA testing. There have been a number of major position statements put out by organizations, including Cancer Care Ontario quite recently, about PSA testing and finding prostate cancer. So it's a very important topic because about 1 in 6 or 1 in 7 Canadian men will be diagnosed with prostate cancer. Now, only about 1 in 30 will die from prostate cancer, but that's still about 3 to 3.5% of Canadian men. So it's a very serious medical health issue. The only way really to find prostate cancer early is with a test called a PSA test. There's also a physical exam where the doctor can do a check of the prostate physically. And most guiding bodies are steering away from routine screening and testing with PSA. But I think it's important to keep in mind that it's really the patient's choice. If you feel you'd like to know your status with regards to prostate cancer, we would recommend you go see your primary care physician, your family doc, and have a conversation about it. There are some pros and cons. One of the reasons it's not recommended as much as it used to be is because once we find men with prostate cancer, there can be some harms from treatment. We've also learned that not all prostate cancers need to be treated. Some of them are slow growing and will never affect the health or the life of that individual. So if we can sort out the ones that are slow growing and not treat those men, then we can eliminate some of the harms that are associated with finding prostate cancer. If we then can treat aggressively the cancers that are more of a threat to men, then we'll really do some benefit in those individuals. So if men feel strongly that they'd like to know about their prostate cancer situation, their health, or their risk, talk to your family doctor. There's a simple blood test that can be done, physical exam can be done, and we can find out whether you have prostate cancer or not. If you decide that the downside of getting the test is outweighing the benefits, then no problem, you don't have to go ahead and have the test. We feel that it really is the individual patient's choice, and I think that you should go to your family doctor, come see a physician, happy to talk to you about the pros and cons, and make a decision about whether we get you tested.